David Bomson. My name is David Bomson. I've been practicing Yamamoto new scalp acupuncture, known as YNSA, for approximately 15 years. I've been using it in my clinic. I've been using this method in the hospital, rehabilitation department, which I work in. Also in a clinic used for multiple sclerosis, Parkinson's, and other neurological disorders. I've run a couple of researches on the effects of YNSA in rehabilitation on patients with neurological disorders. Again, could be mainly movement disabilities. It could be Parkinson's disease, MS, Huntington, and other neuroskeletal problems with very, very positive results. In the last couple of years, I've also been teaching this YNSA method, or I like to say that I've been teaching the YNSA method with my spices. How I found it useful for me, how I found it useful for the cases I've been treating, but giving a great acknowledgement to Yamamoto, Toshikatsu Yamamoto, who is the developer of the YNSA method. So I'm teaching his points, the location of his points, and using his points, but also with my understanding how to combine different points together to get different results. And it's an amazing method. I will start with that. So that's in short about me. So today basically is a kind of presentation of people who, practitioners who are not familiar with this YNSA method, because it's kind of a very kind of a new scalp acupuncture method that not too many people are familiar with, but it's very effective in treating, in managing pain, in pain management, and in neurological disorders. And the great benefit of this method that you can combine it with using just basic body, any type of body acupuncture, any theory of body acupuncture. Could be the Jing-Lu theory, the channel theory, could be balance method, could be tongs, master tong, could be TCM, you name it, all these body acupunctures that you can use, and then you can combine them together. But also you can use this method for as for itself, as a method you can use to treat your patients for itself. And also the greatest idea, what I like very much about this YNSA method, that it can be used anywhere, in any, you don't need a practice table or treatment table to treat a patient. The treatment's done on a chair, the points are needle on the scalp, the patient at the same time has a lot of, he's mobile. So at the same time, after needling the points, you can always combine manual therapy, could be physiotherapy, occupational therapy, could be even massage, could be tuina, or any other manual therapies that you're familiar with. I like very much in rehabilitation to combine it with the patient's daily practice. And then we get actually the effect, if we have 1 + 1, we're actually not getting 2, we're getting 2 and 2 plus, 2.5, the result of the patients. A lot more felt in the patient. That's the benefit for the patient. And it's amazing, even prolonging his practice. So it's an amazing method, and I always recommend to combine it. So for those who are joining us on this presentation and are familiar with the YNSA method, there's not going to be any new information here. I'm not going to be giving out new information. I won't be answering advanced questions on the method. Basically, it's a very basic introduction for people who are not familiar with the method. And after the bit of the introduction, I'm going to give you about 4 points that are actually very useful in treating, very easy to locate, very easy to use in your clinic. So already tomorrow, or even late, if you have patients later on today, you can already apply it in your clinic with much ease. So I'm just going to share my screen. Okay, so I always like, this is a sentence or a saying that was said once by Yamamoto. It's kind of a vague translation to scalp from Japanese. And basically, he's saying if you don't give up at the library, the paralysis and pain can heal. To sum it up in maybe one word, I would say this is neuroplasticity in some manner, which is very, very, if you're looking into medical science, is a very new approach to the brain. And a new approach to the brain is actually that the brain is very, is plastic, and it can always change, it continues to change. And it's always changing. Even now, when your brain's listening to me, it's changing and making new synaptic connections and new connections. And the same idea is here. So what he's basically saying, that if a patient is suffering from pain, for example, and that's what I'll give you points for pain mainly. So even if it's a chronic or acute, the brain is always getting stimulation that he's having pain in a certain area. And he kind of adapts to that pattern or gets used to that pattern. And he's always in that pattern that he's in something in the nervous system is firing off and causing a sensation of pain to the patient. So actually, when you keep trying to treat the patient and you try different approaches and you continue to try and continue to work on subsiding the pain on the patient, because there is some effect when you do an acupuncture on the brain, it's going to cause the brain in the end to cause the pain to subside and even disappear and have it no longer. And the body will adapt to that. So that means if the patient's tried so many things, he's tried, for example, all these drugs that are not effective on him. If he's tried even medical cannabis, and it's not effective on him, and he has this constant pain. So if we get, even in the first treatment, we get a reducement of the pain, we know we're going to have an effect. And then we just got to continue to stimulate the points again and again. After a couple of sessions, the pain level will start subsiding and get to a situation that disappears. But what is happening in the brain? The brain is starting to change. And what happened in the brain, the pattern that he was used to doing is changing to a new pattern, which is allowing the person to adapt or respond or adapt to this pain, so the pain starts subsiding in some manner. So this is basically, in some words, saying it's neuroplasticity. You just got to continue to work on it and don't stick to what the statistics say, because every person is a statistic for himself. So if you stick to the statistics, you're going to always stay in that pattern saying, well, I've tried 2 treatments, there's no improvement. I don't think I can help you. But from Yamamoto's experience, even going back to his early days when he started out with this method, he used to treat patients even for a couple of, let's say, weeks or up to a couple of months and not see any results. And then, but he continued to do the points and continued to do the method. And then suddenly something clicked and the patient started feeling improvement. And when we have that improvement, it might take some time. From there, it's like a ball of snow that just rolls and gets bigger and bigger. Improvement gets bigger and bigger and bigger and bigger on the patient. So this is a sentence I always like to keep in my back, in the mind when I'm practicing Yamamoto scalp acupuncture or any type of acupuncture method for itself. So coming into just a quick history of scalp acupuncture. Scalp acupuncture, or what we call more modern scalp acupuncture, was started out to being developed and researched in the early 50s, where actually you have acupuncture points on the scalp that even if you go back into the Neijing or the Yellow Emperor, some of those points are mentioned that are being used for treating some type of neurological disorder. Of course, it's with their terminology and with our interpretation to their terminology, we understand that maybe they were speaking about some neurological disorders, and the points that are on the head, on the scalp, were used for that. So that's like the classical Chinese medicine. But when you're coming into the modern scalp acupuncture, the basic of the modern scalp acupuncture speaks of a very simple theory that what you want to do is needle certain areas on the scalp that correspond or maybe match to the neuroanatomy of the brain of that location. For example, if I want to affect my foot, okay, by needling an area that matches on the area of the scalp to that neuroanatomy in part of the brain, by needling that, I'm going to have an effect on the foot, for example, because it's very, very close by. We can see that also in acupuncture in general, that idea. If we take all the channels located on the chest, we have kidney channel, we have spleen channel, stomach channel, and we look at all these points, the common ground of all those points, that all those points in some way have some effect on the chest and the upper chest area or lower chest area, because they're very, very close to those organs. The same here, if you needle in the ideal points on the scalp, you're very, very close to the brain in some manner, even though you have a bone here that's not allowing you to penetrate the brain, but you have in some effect, some of the effect on the brain. And this idea and this theory was researched in China by a couple of Chinese medical physicians or doctors. And they were they started to try to look for the connection between acupuncture in general and neuroanatomy and neuroscience. And what happens, they went with this basic idea of how the nerve system works. That if I want to affect the sensory, you have a sensory line, you have a motor line, and by needling those lines, let's say, for example, how the neuroanatomy works, the neuroscience, physiology works. If I want to affect my right side of the body, I'm going to needle contralateral on the left side, because that's the area that's being affected on the brain. And playing that game, you developed all these lines. You have motor and sensory that actually sit right on the homunculus of the brain, or the motor lines, or the sensory lines, where you have those organs that match those areas of the brain, of the acupuncture points. That was the basic theory. And then you have speech areas, you have visual areas, and if you start breaking down where these visual speech areas are, they're very, very close and match those areas in the specific brain. So that was the first theory that they were working off from the 1950s, and then in about 1970s, Dr. Jiao Shunfa presented his work, and which was combining that very basic idea of how neuroscience works, neurophysiology, and acupuncture as one unit together. And this is one of the reasons that Jiao Shunfa's method is very, very accepted in the in the Western medical community, because all the terminology and all the understanding of it is Westernized, and the understanding of how the brain works, how these points work, it's very, very easy to explain the idea. Okay, so that's why you see the many types of scalp acupuncture or a lot medical facilities, that this method is very, very well known. Now, later on, they started doing research. How could it be that we needling points here on the scalp? How does it affect the inner brain? Because you can see the clinical effect of the patient, but it's very, very difficult to do any simulations to what's happening in the brain at the same time. So one of the theories that started developing later on, I'm speaking about like not the 90s, 2000s, or even up to today, that actually by needling points on the area of the scalp, especially because a lot of the points are like located on the temporal region, okay, on the area of the parietal bone. And if we take also, we go into the cranial nerves and we look which cranial nerves are located here in the temporal or the parietal bone. We have the facial nerve, and we have at the same time, we also have the trigeminal nerve. And what is understood that maybe through the innervation of the trigeminal nerve and the facial nerve, we actually get into stimulate certain parts of the brain. Because if we start mapping out the root or the channel of these of the facial nerve and the trigeminal nerve, and also map it out how the root goes in towards the brain, you start seeing that it connects with other cranial nerves. So it's located very similar or very close by to other cranial nerves, and maybe through that we actually getting a whole stimulation on the brain itself. So that's basically the and this theory was tested on mice, and actually they got very, very good. They started seeing that tested on mice, it also had some effect on the CNF of the brain, CNF, okay, and also has some stimulation to the mingins of the brain. Okay, that was tested on rats, and that was the hypothesis was that we actually stimulate we affect in scalp acupuncture the innervation of the trigeminal and the facial nerve. So basically, this is just a drawing saying that no matter what you see here, no matter where you put a needle, you're going to have some effect on the patient's brain in some way. Because these are different maps from different masters or senseis that develop different acupuncture points. You can see we can see here we have the basis of Jiao, Shunfa. We have some of Tang's method, okay, Feng's method, Zhu's method. It's a whole combination here. So amazing, wherever you put a scalp point, you're gonna have some effect on the patient. That's already moving into also microsystem understanding. So this is just a quick breakdown of all these scalp acupunctures, all these developers. Okay, so we have Jiao Shunfa, which is up here because he's actually known as the father founder. From my knowledge, as I know him, he's been known as the father founder of the scalp acupuncture method, even though there were other physicians or masters that were at the same time as him developing the method. But from my knowledge, I know that he's one of the father founders, and he first approached actually the Western community about his method. Okay, coming into and that was all published in the 1970s. So a bit of what is YNSA? So YNSA, first of all, who's Dr. Toshikatsu Yamamoto? Here's an image of him in his younger years. Today, I think Yamamoto's around 92 years old. He's actually, in last April, he retired from medical practice. But in his life work, he actually worked to develop this YNSA method, where he always says that he kind of stumbled onto it. And so a quick history of who Dr. Toshikatsu Yamamoto is. He's actually, he was a medical doctor, an anesthesiologist. He finished his medical practice as a medical school in 1956. He flew to, in anesthesiology, he flew to the United States. He was there in some type of internship. After a couple of years, he flew to Germany. In Germany, he done an internship in obstetrics and gynecology. And after a couple of years, he actually flew back home to his hometown. Now, his hometown was actually an area of a lot of agriculture. So many patients that he was seeing in his clinic were patients that were suffering from pain, different kind of musculoskeletal pain, prolapse discs, sometimes of some type of pain throughout the body due to the difficult work in the fields. And he found himself managing pain as an anesthesiologist. And his first, I think, now he always heard about scalp acupuncture, is what I understood from him, speaking to him, that he always but he never really interested to really go and practice it and learn it. Now, until one, he says, till one day he had some kind of accident where a patient walked into his clinic, and he always said that his treatment was actually just injecting a neuroblock into the certain trigger point to reduce and subside the pain. And on this particular patient, now, as we know, he was mainly using lidocaine. And lidocaine, you have to have kind of a vessel. It's mixed with a saline when it's injected. Okay, in general, any drug that's injected is mixed with a kind of a vessel for the drug. And when he gave the patient the injection, she responded in a peculiar way. She had a sharp stabbing pain, very, very sensitive. And this idea puzzled Yamamoto for a couple of for that day, how come she responded in that manner? And actually what he realized that actually he never injected any lidocaine, any drug. He only injected the fluid, the saline. And that was the only treatment he gave her. And when the patient came back the next day, he was actually she came to thank him, to say that the pain is gone and subside. So that was where Yamamoto started, in that stage already that was his kind of introducement to acupuncture. And from that stage, he started practicing and learning acupuncture. He was very, very much influenced from microsystems like Suju, auricle acupuncture, nasal acupuncture, wrist and ankle acupuncture, his balance methods, very, very much influenced by these methods. And slowly, slowly, he started adapting acupuncture as well into his clinic, also into the operating rooms. He started using acupuncture as a general anesthesia on patients that could not go under a general anesthesia in the operations. So he was using that as well. And then now, from my encounters with Yamamoto, I see he's an amazing open man. It's always looking for these new ideas, how to help his patients more. Like the patient is always in the center. No ego, like always the patient's in the center, and that's what is important to help the patient out. And in his search as well for how to help the patient in a better manner, he came onto the scalp acupuncture, the Chinese scalp acupuncture of Jiao, and he started practicing Jiao's method. It took him some time to really specialize in the Jiao method and use it in the clinic. Due to one of the things that I found in the general scalp acupuncture, which especially when you're a beginner, is that the lines, you have to start searching in the hair. And the only way to know you've needled the correct lines on the patient are according to the symptoms of the patient, if they improve. If they improve, you know you're in the correct line, if the needle's correctly. But if there's no improvement, you have to keep searching till you get some kind of response. So it's always, until you really, really get the feeling how the scalp, how the head is, even if you have hair there, to locate these points and then needle them correctly. So even when I started out, when I practiced scalp acupuncture, I learned scalp acupuncture in school when I was learning Chinese medicine, but I never used it afterwards. Never, because I had the difficulty in locating the points in the first year. So I just said, oh, let me use a different method. Let me use something else. Until I stumbled onto scalp acupuncture. And I found the great benefits of Yamamoto scalp acupuncture, that all the first points are located on the hairline. So it's very, very easy to locate them. And afterwards, once I really specialized all of the YNSA method, I found it was very, very easy for me to now start practicing even the Chinese scalp acupuncture, Jiao style, Feng style, Zhu style, very, very easily. So it's just an advantage which I found on Yamamoto scalp acupuncture. But back to our story on Dr. Yamamoto. So going back to the idea of the line, so Yamamoto started using this Chinese scalp acupuncture in his clinic. And then one day, again, a patient walked into the clinic. This patient was suffering from mainly suffering from shoulder pain or some disorder in the shoulder. And if we take just again, if we have the motor line or the Chinese scalp acupuncture here, for example, and the sensory line, okay, for example, and no, I'm not specifically correct, but the idea. So when searching for actually the area of the shoulder in the motor and the sensory line of the Chinese scalp acupuncture, he actually found about here in this area that the patient, there was an area that was very, very sensitive on the scalp, okay? And when you press down actually on that point, on that area, suddenly the patient found some relief in the shoulder, okay? So some relief in the shoulder. With the years to come, this point, which the first point he discovered, will become known as the C point, okay? That treats the whole upper extremity from the shoulder down to the palm of the hand, okay? Which was here. But from my encounter from Yamamoto, before he approves a point to say that this point has an effect on the shoulder, he would test it on more and more and more and more patients. And when he started seeing in a very, very high percentage that effect, he would say, okay, this point has an effect on the shoulder. This point will affect the shoulder. So that was Yamamoto's first point, which he discovered. And then he actually started the idea of connecting the dots. What do I mean by connecting the dots? He started taking the theory of Chinese medicine, okay, or Chinese acupuncture points. You have Do-24 here. And we know Do-24 here has an effect on the spirit and also in the upper area of the brain. Okay, he said, okay, if we have an area here that affects the brain in some manner, and we have an area here in the shoulder, if we start connecting dots, we're going to discover more and more areas that affect other and different parts of the body and other areas of the body. So, and that's how he started developing his microsystem. Okay, now Yamamoto's scalp acupuncture is more of a microsystem, more than corresponding and matching the area of the points. So you had sort of become A point, which we'll learn today. Then we have B point, which is between the head to the shoulder. And then we have the C of the shoulder. And as we go down, according on the hairline, okay, we're going to come out throughout the whole body. And in the first years, he only had about 7 points, that each point affected a different area of the body. For example, A point affected the cervical spine, E point affected the chest, in the thoracic spine, D point affected the lower extremities. That was in the first years, and there was no diagnosis. The points were actually needled ipsilateral to the symptoms, and he was getting amazing effect. And you're seeing the patient's pain disappear, and slowly also said it not only affect the musculoskeletal, but also the organs nearby. And so those were the first points in the first system of Yamamoto. Now, because Yamamoto, why do we have yin and yang? Now, it's not yin and yang theory, it's more aspects. What the understanding was that because he was affected by this mirror reflection or microsystem, so if the points, 98% of the treatments are done on the anterior aspect, which is more saying yin. But when he saw these points never had any effect, he would transfer the points and look for the same area which match in a mirror reflection on the yang aspect, on occipital bone, for example. It was more the yang, the posterior aspect. So yin and yang are more for anterior and posterior, okay, not for yin theory and yang theory in that idea. Yeah, and that was the understanding. In many cases, for patients that's very weak or fragile, a lot of times you'll get better effects with the yang aspect, from my experience as well. So that was his theory. And from there, he actually, from those 8 basic points, actually, today YNSA has over 60 points, I think. Okay, and it's divided into categories. And the categories, how Yamamoto also discovered these points. We have the basic points, which is actually the first group of points, which I found are very, very important points because they allow us also to landmarks to move to the next points, but also not only landmarks to move in from to the new points, but also can be used. I found them even up to today, that there's other points I found are very, very effective that I always go back to using these basic points. It's kind of like the root of the whole system. And from that, we have, that's the first group. Then we have the brain and sensory points that has also branched out from these basic points. Points specifically affect the brain, 3 zones and 3 areas of the brain, which are the cerebrum, cerebellum. And Yamamoto calls it the basal ganglion area, but I actually found in my experience that the area of the basal ganglion area has more effect on the brainstem, has an effect also on the brainstem area. Because I started seeing the patients that I know that brainstem damage, that a lot of times these points were had some stronger response using that area. Okay, so that's why I started seeing that this is also an area of the brainstem. That's the second group of points. Then we move to the third group, which is actually the epsilon, which are the internal organs, and the channels. Okay, and then we have the fourth group, which are combining like channels and brain points together, which are the cranial nerves. And then you have all these extra somatotopes and all these extra microsystems in these points that are like additional points. So yeah, basically I have up to today over about 60 points or about 5 somatotopes in the YNSA system. Now, most 98% of them are located on the scalp. In recent years, he also found in the area of the ankle some points that have some effect on the patient as well. So that's into that method. Coming back, Yamamoto, YNSA is like a microsystem. Okay, the points will appear up on the area of the scalp, will be very, very sensitive. And by needling them, you'll have that effect on that area of the body. Now, because the understanding of the body, also in his understanding the body is like a whole unit, not necessarily I might see the symptoms of the patient. I might see, let's say, for example, carpal tunnel syndrome, but it's not necessarily maybe the problem is the carpal tunnel syndrome might be in the area of the cervical spine, which is called the carpal tunnel syndrome. Or if I'm having upper neck pain, not necessarily the upper neck is the cause of the problem, maybe the lower back. Okay, so it's looking at this whole unit as this is why we have a spider web. It's also a web of the system, but also understanding that everything is connected one to each other. Okay, and with years, Yamamoto also developed diagnostic areas throughout the body, abdomen, neck, and elbow areas to identify where the problem is coming from and needle those points correctly, which you need to, that's a deeper learning of the method. But so that's the YNSA. Great benefits. I explained about the benefits of YNSA. In general, with scalp acupuncture, you can combine it with manual therapy. Any type of acupuncture can be used with it at the same time. I like this one. You don't need a practice table for it. You can use it on a chair. You can use this method anywhere. The patient responds immediately. In a very high percentage, responds immediately. And I also like this, that you can also use it in any stages of pregnancy. From my experience, and also you can, any stages from pregnancy, especially, for example, we'll speak about it today, but let's say a patient, you have even not only pain, first stages of pregnancy, when you have all the nausea, vomiting, you can combine 2 points together and get very, very good effects, which are D, which has an effect of the lower body, E, which has an effect on the chest, and can teach a patient even to massage these points to calm the nausea and the vomiting down. That's just I like to use that in stages of pregnancy in the first day as a protocol. And I even teach the spouse or even the patient these points where they massage them, and we're getting great effects. But also, so that I like about pregnancy. Just a quick comparison between scalp acupuncture and YNSA, just to get an understanding of the idea. First of all, scalp acupuncture was, like I said, was first presented in the 1970s. Yamamoto started presenting his work in 1973. Okay, 1973, and it was called New Scalp Acupuncture, just to say that it is a different method from scalp acupuncture, from the Chinese scalp acupuncture. And then it became Yamamoto New Scalp Acupuncture. Okay, so, and that was just 3 years later. 3 years is not that much in life, but that's just to know that why one's called YNSA and one's called scalp acupuncture. First of all, YNSA is therapeutical points. Even when you have lines or zones, you're going to look for the most sensitive point there, and you're going to needle that point. Okay, scalp acupuncture is more of a threading method. They got to thread through the point and manipulate the needle. In YNSA, it's not necessary to manipulate the needle because the patient is constantly moving his muscles of his face, his mimics of his face, twitching his eyes, moving his head, and even that's causing some type of stimulation of the needle, which is getting an effect on the patient. So it's not necessary to stimulate the point. So it's more, I found it's more friendly. Okay. YNSA has diagnostic areas, diagnostic palpation areas, where scalp acupuncture, more the modern, it's according to the symptoms of the patient, but also you can do a Chinese diagnosis. And then there's like Zhu style, speaks also about doing a Chinese diagnosis and used in certain areas on his method to affect those areas. Okay, but the threading is very important. Also, YNSA, according to after you needled, you know you needled the correct point because the area of diagnosis will subside. So you know it's not like working on blind. When Chinese scalp acupuncture is more, if the symptoms start decreasing, you know you've needled correct. It's quick then. Now, both of them have advantages and disadvantages. It's not that I'm pro YNSA only or pro scalp acupuncture. I actually, each one of them has a different pros and cons, okay? So, like from my example, just to explain about that, I found that YNSA is a lot more friendly for the patient. It's a lot more easier to practice, for example, but I found that I'm having very, very difficulty in treating patients with spasticity of YNSA. But with Chinese scalp acupuncture, I'm getting very, very good results with patients with neuroplasticity, with with spasticity. So I combine sometimes the two methods together. Okay. A bit of the needling, like I said, I spoke a minute ago about the needling. So the points are actually needled to the subcutaneous tissue, okay, just below the last subcutaneous tissue. So for example, I would, and it's usually sensitive. So if I have a little granule here, which is a little sensitive, okay, I would insert the needle through the skin, look for that little granule, and insert it into there. A lot of times when you hit that point, the patient feels like a shock. And you know when that happens, you've reached the correct point, and you're going to have a very strong effect on the patient. But that's where you want the needle to be inserted. In general, there's not, YNSA does not have too much contraindications. The only major contraindication is a fever of 39.5 centigrade fever, or I think it's 103 Fahrenheit, if I'm correct. So that's the only contraindication. And you have caution. You have to be cautious when your patient has low blood pressure or is very, very fragile. You have to be cautious. Okay. In general, when you're applying scalp acupuncture. Okay, so that was our introduction to YNSA. In general introduction, how the method works, when you can use it, how you can use it. And like I said, I just want to give you a few points. I'm not going to go into the whole teaching you the diagnosis, but when you want to use these points as just an extra point into your treatments, or even just like for an acute pain. Okay, so we can learn 4 different points that cover the area of the head to the cervical spine, which is the A point, which we'll speak about in a minute. Then we have the B point, which is actually the area that overlaps between the head, neck, and the shoulder, the upper nip area, okay? Upper trapezius, horizontal trapezius area, okay? That's going to be our second point. Then we're going to cover the thoracic spine, okay? Another point, which is actually E point. And then we'll speak about D point, which covers the body from the diaphragm down to the feet, the lower extremities. Now, what is more important in these points, instead of going to specific indications of them, it's more to understand the location of what these points cover, what area they cover. And why is that? In one of my encounters with Yamamoto, when I asked him, he said, well, the point does A, B, C, D, and the rest is open for imagination. So if you stick to indication, say, okay, A point is good for migraines, it's good for the upper officials disorders, it's good for movement of the neck, for example, upper neck or neck pain, and you stick only to those indications, instead of thinking, okay, A point covers the whole area of the cervical spine, and if from this understanding the rest is open for interpretation or imagination, then maybe if I have a skin lesion here, for example, a very terrible itch, then okay, let's try it on this terrible itch in the neck. Okay? Or if I'm having a problem with my vocal cords, for example, oh, let's try it on my vocal cords, because it just sits in the area of the cervical spine. The same if you have for E point, it's mentioned that's good for pulmonary cardiovascular disorders, and also thoracic pain. But if you think about heartburn, you can treat heartburn with the E point. That's just really, it's not mentioned there, but if you go out of the imagination, this is what I've done a lot of with these points. So that's what I recommend with you. Just understand which area the point covers instead of going on a specific indication. So, like I said, the location of the points are very, very easily. First of all these points are located on the hairline, as you can see here. Okay, so it's very easy to locate. Now, A point is a 2 centimeter vertical line. Okay, 2 centimeter vertical line. It starts from 1 centimeter into the hairline to 1 centimeter below the hairline. Okay, the upper area, which is A1 here, is going to cover the head, for example. And as you go down with the line, you're going down with the cervical spine till the bottom part here will be A, which is A2, is actually C2, C8 area. Okay, cervical 8. And this 2 centimeter vertical line is located approximately 1 centimeter lateral to the mid-sagittal line. So just to make it easier, it kind of sits in the same line of bladder 2. Okay, if you go to the area where you have this, where the eyebrow is very, very thick, and from there you go up, and that will give you approximately that lateral point. Okay, now why am I saying that everything is approximately? It's instead of saying tsun, Yamamoto doesn't use the terminology of tsun, it's approximately 1 centimeter, with a proportional measurement. For example, if a patient is a big forehead or high forehead, the points will be longer, or short forehead, you'll be shorter, or if he's wider forehead, then it's going to be further apart from each other. But that's the understanding. It's approximately. Okay, so I'm trying to give you the anatomy to know where the points are located. And when you palpate things, you look for the most sensitive point, and that's what you want to needle, the most sensitive point on that line, even though there's a line. Sometimes in A line, you might use 2 to 3 needles, or maybe even only 1 needle. Okay, so that's A. Like I said, A covers the cervical spine and the head. Next point is B point. So as you can see here, A, according to, you can see here is an area called the supraciliary ridge. As a supraciliary ridge on the frontal bone integrates towards the area of the glabella, just about here, that's where the A line is situated. Okay. Coming into B point is actually 1 centimeter lateral to A. Sorry. B point is 1 centimeter lateral to A, and it's a point that's located on the hairline. This point covers the area between the overlapping between the cervical spine and the shoulders. So it covers the whole upper area of the upper trapezius and horizontal trapezius area. Okay, from the clavicle area to the spine of scapula area. So it's also a very, very useful point for treating scalenia disorders. Okay, problem with the scalenial muscle, very, very useful that for scalenial syndrome, or even the brachioplexus area. Very, very strong point in using those problems in that area. Okay. Next point, I'm going to jump into D point. D point is a point that located, if we have on the anterior hairline, on the midway between, it's on the anterior hairline, it covers any disorder from the diaphragm down. So it's lower back pain, lower extremity pain, radiated pain, could be, but also affect the intestines, the stomach, the liver, okay, all the organs that are below the diaphragm. Now this point location, it's a very general point, is actually located at the height, about 1 centimeter above the superior border of the zygoma, okay? And it's located in the midway height, I mean, between the outer canthus and the root of the ear. So you draw a line from the root of the ear to the outer canthus, from the outer canthus, in between the two, that's where the D point will be located. I'm going to draw everything out quickly in a minute, and we'll have a video to show you locations, so don't worry about that. Okay, so we have these images here, again showing you where those points are. That's the D point. You can see it sits right on the suture. So it's going to be very, very deep. You're going to feel, you're going to needle quite deep there. Then we come to what's called extra D point. Extra D point is actually very, very good for the lower spine, maybe for L1 down to the S1, more for musculoskeletal disorders. So very, very useful. In many cases, you're going to combine that D point, because D point is actually opening up the whole lower extremities, the whole lower back area, allowing more freedom of, let's say, we'll say flow of blood or chi. And then actually the extra D is actually going to pinpoint the segments where the problem is and needle that area and get the pain to subside. So actually, it's actually 6 points that are actually, we combine them into a line. I like to say me and Avi, we combine them into a line that's just below the connection between the ear and the face, posterior, just where the hallux and the cross of hallux meet, in that notch there, just above the zygomatic bone, right at the anterior upper corner of the ear, where the face and ear meet. You can feel there's a notch there, and the upper part of that notch is going to be D1, L1, and the lower part is going to be D5 and the sacrum. Sacrum we look at as a whole unit. So that's that. Next is E point. E point covers the thoracic spine. So like I said, well, I spoke cardiovascular, pulmonary, I spoke about heartburn, but also any pain, movement of the scapula, scapular pain, subscapularis pain, infraspinatus, and etc. Infraspinatus, supraspinatus area. Teres. So you have that whole thing for the motion of the shoulder, which is very, very good. Okay. E point is located right in the area which is called the superciliary ridge. If you feel your eyebrow, okay, feel your eyebrow and just go above your eyebrow, you feel that you're in a ridge. Okay, that ridge there is a superciliary ridge, and that's where the E point is located. And if you go medial with it, until actually what happens, it integrates to the area of the glabella. Okay, so that's about 2 centimeters, oblique 5 to 15, maximum 15-degree angle. Okay, and it starts from the pupil line, that's going to be T1, and as you go inner, right to it integrates with the glabella, that's the end of it. So it's in the same line with A, bladder 2, that's going to be T12. So that's the E point. Okay, as you can see here, if you go above the bone, you can see a notch here, that's called superciliary ridge. Okay, you can see it's with the pupil line starts, goes inwards to E12, which is T12. So like I said, I want to draw it out for you. It'll make it a bit easier. So first of all, when we join out the points, we need to understand where is the natural hairline of the patient. Okay, so actually the easiest way to know where the natural hairline of the patient is just to ask him to raise his eyebrows. Okay, if you raise your eyebrows, you can see the frontalis muscle, that the anterior frontalis area that contract, and then you have the occipital frontal ligament. Okay, and where it meets, that's going to be your anterior hairline. So if you can see this Avi here, my partner, would contract these muscles. You can here would be his anterior hairline, and it goes right to the side and then just goes down with the sideburns. Okay, so that's his anterior hairline. Okay, if you can see here, would be contracting here. Okay, so we have our anterior hairline because that's where the points are located. That's why it's important. So that's, then we're going to draw out here the mid-sagittal line. Okay, so we're going to start with A point. So like I said, A point is a 2 centimeter vertical line. It starts from 1 centimeter into the hairline to 1 centimeter below the hairline. So if we have the area here, we can see we have the superciliary ridge, and then the superciliary ridge integrates to the area of the glabella. So you can see the medial part of the eyebrow. It's a lot more thicker. That's going to be approximately my 1 centimeter lateral to the mid-sagittal line. So that's A point. Okay, cervical 1, cervical 8. That's A point. Then coming to B point. Now all the points are bilateral. So you need a, we're not going to go into diagnosis, but just use it. It's very, very simple. All these points are needled bilaterally to your patient's problem. Okay, if I'm having a problem with my left cervical spine, I'll needle these points on the left side. Okay, if I'm lower back pain on my right side, I'll use D on my lower, on my right side. Okay, so that's A point. B point, like I said, B point is a point on the mid-sagittal line, which is about 2 centimeters lateral to the mid-sagittal line or 1 centimeter lateral to A. So you take this distance and you just multiply it. So that's going to give you B point. Okay, that's B point. Then we come into D point. So like I said, D point is about, here's a zygomatic bone, approximately a centimeter above the zygomatic bone. That's one way. First of all, that point's located on the anterior hairline. But remember when I said you're going to take the outer canthus of the eye, go 90 degrees back, just an imaginary line, 90 degrees from the root of the ear. Okay, and in between these two, that is where that D point is going to be located. Okay, that's going to be the D point. Then we come into the root of the ear because we have the extra D point. We go see here, we have the root of the ear is right here, just slightly below it. We have the hallux, and then we have the cross of hallux. And where the ear cartilage actually meets the face. So right around here is going to be the extra D. Upper here is going to be L1. Down here is going to be L5 sacroiliac. So it's like 6 different points that we combine into one line. Okay, so that's the D point. Next point is E point. So like I said, if you have the eyebrow, you go slightly above the eyebrow till you fill into a notch, which is called the superciliary ridge. That's going to be T1. And you go off that ridge. You can slightly see that ridge here till it goes to about here, the anterior eyebrow, where it integrates. Okay, so that's going to be E point. T1, T12. Remember, in the YNSA method, whatever's more superior is going to cover a higher part of the body and then go down. So just to make it also easier so you can see it in live, I'm just going to show you a quick video. We'll go through the videos on these location of these points. So here's these points of A and B. I'm just going to make sure quickly that you can hear it. Okay. Oops. Okay. Just, can you hear the video?
After we located the front hairline and the mid-sagittal line, we're going to start to locate the basic points. Before that, we have one explanation. We're going to speak as approximately a centimeter, but the centimeter can change. This is an estimated distance, and it's really depend in the size of the scalp and the structure of the anatomic of the scalp. Okay, so it's a bit in the meaning of zoom. Okay, so we start with the first point, A point. A, it's a line. It's a 2 centimeter vertical line that starts 1 centimeter lateral to the mid-sagittal line. Okay, so we're going 1 centimeter lateral, approximately 1 centimeter lateral to the mid-sagittal line, and then we're going 1 centimeter into the hair, and then 1 centimeter below the hairline. Okay, so that makes you 2 centimeter vertical line. The upper part will be the head and C1, and as we go all the way down, that will be C7. The area that the hairline goes is about C3, C4 vertebra. Okay, again, we spoke about 1 centimeter approximately, but we want to do it more exact. So what we want to go to see is where UB2 line, the UB2 point located, and then we are going directly above it and go all the way till you meet the hairline. That will be the approximately 1 centimeter for you. Next point we are going to locate is B. B is just a point on the hairline, and it's located 2 centimeters lateral from the mid-sagittal line, or approximately 1 centimeter from the A line. Okay, and it's located directly on the hairline. B covers the area of the neck, between the shoulder and the neck.
Okay, so that was A and B. That was A and B. And next points will be D and E.
The next point we are going to locate is going to be the D point. The D point is located approximately 1 centimeter above the zygomatic arch. Okay, so we want to palpate the bone and go about 1 centimeter. To find the exact location, what we like to do is to draw an imaginary line. You see this yellow line that we draw here? It's not a point, it's just an imaginary line that...
Okay, let's understand here what we're speaking about an imaginary line. It's actually just making a shortcut from what I done from the root of the ear, taking a line from the root of the ear and the outer canthus and seeing where it mixes. Because if you take an imaginary line that goes down from the root of the ear down to the outer canthus, you will see you'll have the same angle. So that's another why he's speaking here about the imaginary line of an angle line. Sorry. What's going on? Okay, so we went wrong.
Help us to find the D point between the root of the ear and the outer canthus of the eye. Okay, so when we drew this line and it meets the front hairline, D will be exactly in the meeting of these two lines. And the D point is cover all the area from the diaphragm and down to the feet. The extra D point. Extra D point is actually 6 small points that covers all the area from L1, the lumbar vertebra L1, all the way to L5 and then the sacrum area. We prefer to make it a one line because it's very small area and it's hard to locate exactly each one of the 6 points, so we cover it as a line, and then in the palpation we find the sensitive area, the sensitive point on this line, and then needle that. The small line of extra D is located in the notch just in front of the ear and the connection of the ear and the face, behind the temporal bone. Okay, the height is starting from the hallux and all the way down to the cross of hallux, and you want to palpate a finger width notch. Okay, so like we said, it's covering the lumbar region but by orthopedic way from L1 to sacrum. Now we are moving to point E. Again, E, it's a line. It's approximately 1.5 centimeter line, a bit oblique. Usually it's run with 5 degrees angle down. And the location that we want to find is an area that's called the superciliary ridge. Okay, this ridge is located just above the glabella bone, the eyebrow bone. Okay, so we want to go from the eyebrow and go down to the ridge, or alternately go from the forehead and slide down till you feel the elevation of the eyebrow bone, the glabella bone, and then you want to stop on the ridge and be in this area. Okay, the lateral border of this line is going to be the pupil line. Okay, so we want to see the pupil line and go the pupil and go again just above. When you fall to the ridge, that will be the lateral border. As you go medially, you want to stop the line when the ridge is blending or disappearing with the mid-glabella bone. Okay, when you don't feel again the ridge, that's where you want to stop. Again, it's going to be approximately on the line of UB2 point and the line of A. And E treats the thoracic area from T1 till T12.
So that's our short introduction to YNSA. I'm